It's 12:02. Want to be mindful of everyone's time and make sure that we have enough time for discussion at the end. Okay. So good afternoon, all. Thank you for joining us today to share the findings in our first ever Family Forward NC Certified Employer Benchmarking Report. Our goal with this report is to spur action by you and employers across North Carolina to review your benefits, see how they stand up to others in your industry or your size, understand what our employees are saying, and consider how this discovery can translate into action. At Family Forward NC, our aim is to move employers to increase and adjust their benefits through our certification process. This will be a 30-minute webinar with about 10 minutes for Q&A after the presentation, but please feel free to engage using the chat throughout the presentation. Also, I do want to let you know that this webinar is being recorded. And let me share my screen. One second. Okay, making sure everything looks good on your end. Good? Okay, perfect. All right. So the report that we'll be talking about today is Work That Works for Families, Benchmarking Family Forward NC Certified Employers. Um, I am Rosa Soto Brown, Employer Relations Specialist here at the North Carolina Early Childhood Foundation. And my colleague Kaylin Sloan will also be presenting today. She's our finance and operational manager. So to get us started, in 2022, the Family Forward NC certification was launched as a way to recognize employers that offer policies and practices that support the health and well-being of children in North Carolina. By June of last year, when we decided to begin this process, we had certified 132 businesses representing 296 business locations and over 59,000 employees. This benchmarking report analyzes certified employers, their benefits, and employee perspectives to measure how they stack up against other state and national employers. For the past 5 years, as you can see on this slide, North Carolina has been ranked a top tier state for business, ranking number one in the country 3 times in the past 5 years, and number two in 2021 and 2024. Yet we rank 29th in quality of life and have a grade C in child care availability and affordability, healthcare costs, living wage policies, and access to paid leave. As more businesses and people move to this state, it will be even more critical to provide employees with the family-friendly workplace benefits that they need to thrive, and that businesses need to remain competitive and keep North Carolina competitive overall. Some people are moving here from states that provide access to family-friendly benefits, and they will have those same expectations when they move here. As you look at this report, just remember that family-friendly benefits are key to recruiting and retaining talent. We can't continue to be top state for business if we aren't also a top state for families. Family Forward NC certified employers are already creating ripple effects for young children, families, and communities across the state. This report underscores the urgency of building on that momentum. Creating supporting workplaces is business smart, family friendly, and future ready. As mentioned earlier, this report represents 132 employers across the state, with 62% of them being private businesses. But you also see some representation in the not-for-profit space and some government organizations. Employers range by size, with 49% having 5 to 49 employees. We certify businesses in various industries. As you can see listed above below, the top 3 certified employers are 27% businesses in education, 22% in business services, followed by health, social, and personal services at 21%. Some of these top industries were also found to be highly successful in implementing remote and hybrid work, which I will discuss further later in the presentation. Our employee demographics. As far as employee demographics, we surveyed a wide range of people with different ages. We surveyed nearly 8,000 employees. 44% of these employees listed to be parents or guardians of a minor. 56% not parent, guardian, or minor, but just keep in mind that we do take into consideration employees that could, even though they may not be parents of children, they could potentially be caregivers of family members. And there's also a wide variety of ages that were represented in these surveys. Something that we did find in the reporting was that 89% of employees reported earning a living wage or higher. And I'll pass it on to Kaylin.
Thanks, Rosa. So our application for Family Forward NC employer certification covers 5 pillars of family supporting practices and policies. Specific policies in each pillar you see here are based on the best practices informed by the American Academy of Pediatrics, the North Carolina Breastfeeding Association, and others. During application, employers answer questions about policies that they may offer at their workplace within each of these pillar categories. We then collect anonymous surveys from their employees to gauge satisfaction with and use of the supports that are offered. In the next slides, we'll review highlights within each pillar from the employer and employee perspective. The first pillar, paid leave and wages, includes paid sick time, vacation, paid time off policies, paid parental leave, or paid family or caregiver leave. This pillar also considers how compensation is determined, like a family sustaining wage, also known as the living wage. The US is the only developed nation in the world and one of a handful of countries with no national paid family leave policy. In North Carolina, in 2019, Governor Roy Cooper issued an executive order to provide paid parental leave to all state employees under his purview at the time. Since then, other large employers have followed, including the public school system. But overall, very few employees in North Carolina have access to enough paid leave. And in many cases, if they have access to unpaid leave, they can't afford to take it. We found that our certified employers most commonly offered paid sick and vacation time, whether in the form of 2 separate policies or a single paid time off bucket. Almost 3/4 of certified employers offered some form of paid parental leave, either maternity, paternity, adoption, foster guardianship, or some combination of those leaves. The best practice for the length of paid parental leave to offer is a minimum of 12 weeks, as recommended by the American Public Health Association and other councils. Nearly 1/4 of certified employers offered at least 12 weeks of paid leave, and another 17% offered between 7 and 11 weeks. While this is better than statewide, 2 of the top 10 requests from surveyed employees are longer paid parental leave and specifically longer paid maternity leave. This presents a prime opportunity for certified employers to build on the policies they already have to better meet the needs of their employees, particularly in industries that are least likely to offer paid leave. On the next slide, you'll see a quote from Jemiah Waterman, People and Culture Director at the City of Greensboro, who is a certified employer. We give our employees the space to care for a new child or support a loved one during illness without having to choose between family and financial security.
The next pillar is flexible work and scheduling practices. A significant amount of research suggests that flexibility in all forms is one of the most beneficial policies to help employees balance family and work. Having some control over when or where to work allows employees to juggle the demands of long hours and care for their family. This was a major takeaway from COVID, as many employers were forced to be creative with both work access and scheduling. Employees, too, realized the benefits of working remotely. This research continues post-COVID, and findings persist that employees are happier and healthier when flexibility is offered. The good news is that most of our certified employers, 85%, are able to offer remote work to some or all of their employees in a hybrid or fully remote situation. Others, due to the nature of their business or internal reasons, require employees to be on site. The vast majority of nearly 8,000 employees surveyed reported that they are satisfied or extremely satisfied with their employer's policies on flexible scheduling, predictable scheduling, and remote work. This demonstrates that these employers are stepping up to meet the needs of their employees in a meaningful way. In North Carolina, 67% of children under age 6 live in households where all available parents are in the labor force. I like to note that predictable scheduling can be especially vital when remote work may not be an option due to the industry or the nature of the job. Certified employers overwhelmingly prioritize flexible work and predictable scheduling as core business strategies to remain competitive in North Carolina's tight labor market. Our manufacturing, hospitality, healthcare, and retail certified employers, although historically not being able to offer remote work, have leaned heavily into predictable scheduling.
The next pillar is pregnancy and lactation accommodations and support, such as breaks, as needed, job duty accommodations, or providing a private space for pumping for employees. 72% of working women will become pregnant while employed, and many will need minor accommodations to protect their health and their baby's health. Congress recently passed 2 laws requiring employers to provide accommodations for pregnant and breastfeeding employees. The PUMP Act, providing urgent maternal protections, and the PWFA, Pregnant Workers Fairness Act. Both laws went into effect in 2023 and allowed employers a 2-year implementation period. Under the PUMP Act, employers of all sizes are now required to provide a reasonable amount of break time and a clean, private space that is not a bathroom for lactating workers. Today, nearly 3/4 of workplaces in the US have a dedicated lactation room. Family Forward certified employers are in line with this, at 67% providing a private lactation room. 87% of certified employers also offer breaks, unpaid, and as needed for pregnant employees. This suggests there is still some work to be done in this area. I'll hand it back to Rosa.
All right, each of the pillars we've covered thus far are very important for ensuring the health and well-being of employees. This next pillar, however, is especially essential for families and probably one of our greatest areas of opportunity. The United States spends less on childcare than almost every developed nation, and childcare funding makes up just 1% of North Carolina's state budget. A lack of affordable, accessible, and high-quality childcare has unfavorable consequences for the workforce. It often forces parents, particularly mothers, to leave the workforce, reducing their paid work hours or pass up promotions or professional development opportunities. Only a microscopic 3.4% of families have a stay-at-home parent. 75% of moms and 50% of dads in North Carolina say they've passed up work opportunities, switched jobs, or quit to care for their children because they couldn't find affordable childcare. Annual losses from inadequate childcare cost North Carolina's families, businesses, and the state's economy $5.65 billion per year due to employee turnover and absenteeism and reduced tax revenue. A lot of great work has been done by the NC Department of Commerce, Chamber of Commerce, and NC Child to bring awareness to the role of affordable childcare in facilitating work-family balance. Employers can play an important role in addressing childcare needs for their employees. While it may not be feasible for every business to provide on-site childcare or full childcare subsidies, there is still a landscape of policy options and benefits that businesses of any size can offer to help ease the immense burden of finding and affording childcare. Employers can implement the TriShare option, where a public-private partnership splits the cost of childcare equally between employers, employees, and the state of North Carolina. Among Family Forward NC certified employers, nearly 1/4, 23%, offer some form of financial assistance or on-site childcare for their employees. The majority of Family Forward NC certified employers offer a variety of childcare resources, including referral services, access to community resources, and employee assistance programs. These resources can be a cost-effective option for businesses, although they do not provide any financial benefits to help families with the high cost of childcare. 29% of certified employers don't offer any childcare benefits at all, including nearly half of the largest businesses that traditionally possess the capital and infrastructure to support large-scale programs. This variety is mirrored among employees' perspectives and understanding of childcare policies. They lack clarity on the type of childcare supports that should be offered, how they should be offered, and how to best communicate to employees what is available. This graphic further emphasizes that among each of the pillars, childcare is the category of benefit that employees are most unclear on compared to others. They reported high levels of confusion regarding what benefits are actually available, highlighting a communication gap between HR departments and staff. And we have another quote here from another one of our certified employers, Capital Broadcasting Company. Offering the child care scholarship benefit is not a major lift for us. What would be a heavier lift is trying to replace the great talent that we have on staff. By investing in our people, we feel that we're actually saving money. And that's by Pam, Vice President of Human Resources.
The final pillar of our certification and in our benchmarking report includes health and wellness benefits like medical, dental, vision, or disability insurance, flexible spending accounts, or employer covered insurance premiums for employees and dependents. Having health insurance can protect families from financial crises, helping parents remain healthy and in the workforce. Children with health insurance are more likely to have a regular source of care for preventive services and developmental screenings, or to treat conditions or injuries, helping those kids remain active, healthy, and in school ready to learn. Out of our certified employers who offer medical insurance, we found that 82% pay between 51 and 100% of their employees' medical premiums. However, nearly half do not contribute any financial amount towards dependent premiums. This leaves many employees to cover the full cost of insuring their family members. Another wellness benefit is the Employee Assistance Program, EAP, which is typically voluntary and free to employees to access. Referrals and counseling for issues like child, family, or elder care, substance abuse, workplace or partner violence, or other emergency situations. Nationwide, nearly all mid to large companies offer EAPs, but only about 4% of employees use them each year. While stigma surrounding mental health keeps some employees from using the EAP, they also just don't know the EAP exists. Similarly, the majority of our certified employers across nearly all industries do offer an EAP. However, 27% of surveyed employees reported using their EAP, which far exceeds the nationwide use of 4%. Very few surveyed employees said that they were unsure if their employer offered an EAP. This indicates that our certified employers are providing clearly defined and helpful guidance around the use of EAPs, more so than most other companies. And we have one final quote from Dogwood Health Trust, another certified employer. Offering an EAP to our staff was very meaningful during the Hurricane Helene aftermath. As our EAP is local to our community, they understood the impact to community members. EAP helped keep our staff informed with daily resources, updated by email on crucial need-to-know information, as well as addressing mental health in times of crisis.
So as we close out our presentation, we do have some recommended next steps. First would be establishing parity for paid parental leave between mothers and fathers, and increasing weeks of paid parental leave. Aligning parental leave between birth and non-birth parents significantly impacts talent acquisition. Also providing support for childcare through a financial contribution to lower parents' burden. The biggest pain point, as we explained during the presentation for employees, is the financial strain of dependent care. Offering even minimal financial support through dependent care FSAs or vouchers significantly builds a protective wall around your talent. Also providing more financial coverage of dependent healthcare premiums.
Another recommendation is to regularly engage employees about policies and benefits, while also acknowledging that this kind of engagement takes effort from the employer and the employee. Ensure compliance with any new federal laws, like what was mentioned earlier, the PUMP and the PWFA Acts. And last, become advocates for policies that support working families. And one way that you can become an advocate is to become Family Forward NC certified and join our 147 certified employers and their more than 66,000 employees in supporting families and children in North Carolina. The application and details about the whole process to certify is on our website, familyforwardnc.com, and can also be accessed through this QR code. on the right. And the benchmarking report, the full report, can be accessed also on the QR code on the left. And I'll just give a quick shout out to our funders, Truist Foundation, NC Institute of Medicine, and NC Department of Health and Human Services. And NC Early Childhood Foundation is our nonprofit organization who runs Family Forward NC.